Hi, this is Harsha, doctor in Panchakarma. Okay, today we are going to discuss regarding Panchakarma through the treatment towards the disease. See, if you think about the disease, there are so many variations. In the general medicine, in Ayurveda, they are treating with several aushadas like kashayas and gutika, like that things, and we are subsiding all the diseases. After treating that, that is called shamana treatment. Once if it is not curing with the simple conservative treatments, then for the disease also we are treating with the panchakarma. That means excess doshas is there, which is not at all curing with the simple medication of kashaya or chona or whatever the tablets, additional application of oils or whatever it may be. Then the role of panchakarma is highly impact to treat which is not at all treatable with conservative treatments. Then after conservative treatments also, if we are not at all, the patient is not responding, then we have to treat with the application of panchakarma. If we are adopting or applying any sort of panchakarma, then we have to think Ayurvedic parameters like the diagnosis and nidana, purva rupa and rupa, upashaya, samprapti, like that disease schedule. Once if we are thinking all the parameters for what causative factors the disease occurs and what is the predominant symptoms is there and what is the desha and which part of the area, whether he is living in a chilled area or hot area or mixed one, like that weather temperatures also can see, and socio-economic status and vata and pitta and kapha, that is the basic schedule of the prakriti, constitution of the body function, how the vary of the disturbances or functionings of this particular doshas. Once if we analyze, then only we can think about in which sthana is more predominant than other sthanas, that is vata and pitta or kapha, or vata pitta is more or pitta and kapha is more. Then only we can conclude that which type of treatments we can adopt in that particular doshas. Generally, if we are thinking about vata domination more, then we can adopt vasti like that treatments more, because vasti is having the more role for dealing off of the diseases. In Shastra also there was mentioned Ardha Chikitsa. Vasti is mentioned as Ardha Chikitsa. That means whatever the disease is there, if you adopt Vasti, almost all half of the disease will be vanished like that. So most of the Vata provocating diseases is more for dealing, the best treatment, best dealing with the Vasti. Then if you think about other areas of the constitution, the pitta diseases, which is more pitta, gastric problems or gastric bile juices and bile problems, all the problems especially in this particular two regions, that means from heart to abdomen. So in this particular region we are calling is pitta region, and below the umbilicus we are calling it is vata dominant. So above the heart we are calling is kapha. If it is between the heart and abdomen regions, we are calling it is pitta diseases. So if once in this particular area, whatever the disease is coming, then the best remedy in the panchakarma is virachanam. Virachanam is nothing but purgation. So for purgation with the oils and with the medicated chonas and with the gulikas, like tablets also, we are advising based on the patient's condition and constitution, and seasonal and ahara and vihara also as mentioned. Because based on all these perspective aspects only, we can adopt the medication and adopt the treatment procedure also. If we are not assessing all the constitution and ahara vihara of the patient, ahara vihara means it is the dietic and what is the habits of the patients. Generally we have to check all these parameters, and if it is the old man or or child or in the middle age. Like these are all the parameters we have to keep. And once if it is the Vata, the best treatment is only Vasti. And the Pitta disorder, we have to incorporate the Virechana. And above the heart, we are adopting Vamana or emesis process. And also the Sirovirechana. What is called, it is nothing but Nashyam we are calling, nasal administration of medicated oils. So with this 3 or 4, 5 holding capacity, we are dealing all Panchakarma treatments. One is nasal administration, we are calling it is Sirovirechana or Nashyam, and one is Pitta, should be eliminated with the Virechana, and third is enema, that is nothing but enema means Vasti. We are calling it Niruha Vasti and Anuvasana Vasti. Niruha is always medicated kashayas and medicated decoctions. We are boiling and we are giving some sort of honey and medicated oils and rock salt. With this, we are giving almost all 1 liter. We are inserting into the anal route. And medicated oil enema is there. That is called Matra Vasti or Anuvasana Vasti. So with these 4 procedures, and one is emesis, that is vomiting procedure for kapha dosha. So by adopting this type of 5 holding therapeutics, we are dealing almost all the diseases, whatever the disease, whether it is neurology or nephrology or urology or orthopedics or gynecology, pediatrics, and even skin or psychosomatic disorders, mental diseases, eye diseases, whatever the diseases we are having, with this only 5 types of Panchakarma, we are dealing almost all the diseases. That's why Panchakarma treatments is only 5 was mentioned according to Ayurvedic classes. Suppose if we think about neurology wise, commonly we are dealing all left hemiplegia, right hemiplegia, whatever the hemiplegia, before the 6 months is highly responding, at least 60 to 70% of the recovery by adopting some sort of Vasti and Virechana, and some sort of external treatments also is there. That is, we are calling is Upakramas, that is Lysichil is there, and Sastika Shali Pendas